Grant Gallimore, and I just started as a hospitalist here at Henry County Medical Center. My wife and I both went to college at Murray State University. We both started out in music, strangely enough, and then neither one of us were planning to do that as a career. But switched over to chemistry, and so kind of like the analytical side of things, and so that led me to kind of finishing up the pre-med degree and then heading off to med school at University of Tennessee in Memphis. And so that's where I did med school, and then in 2011 I was in the Air Force, so I ended up heading down to Keesler Air Force Base in Biloxi, Mississippi. And so I was there for 3 years, and then I went to San Antonio for fellowship for 2 years, and that was in nephrology. And I had done, just to be clear, it was internal medicine is what I did at Keesler, and then I did a couple of years in nephrology at San Antonio, and then I came back to Keesler Air Force Base for a few years as a staff for the residency. I've been in Clarksville for the last 2 years, and I was working in hospital medicine there. My family is from Puryear, but yeah, so we've always grown up around Paris, and I went to Henry County High School. It was a great place to grow up. So involved in a lot of sports, and a lot of the youth leagues here, and in all sorts of different things, and then got to play golf in high school, and some tennis and basketball over in Puryear, and a little bit of football. And it was just a great community to grow up in. My dad is a pastor here, so when I think about my childhood, I always think about church life and what that was like. It's a wonderful community. So I would say, as a community, that coming back home to Paris has far exceeded our expectations. Yeah, this is home for us, and so really the biggest started seeing the life decisions a little bit differently, in the sense of what are going to be my greatest regrets in 20 years, and kind of making decisions on kind of that basis. What can I live with and what can I live without? And just decided that having a bunch of nieces and nephews growing up here, and my own girls growing up, parents getting older, and then my wife is from here as well. So kind of having both families here in the same community, everyone is great, and no one else ever moved away, and so it was getting awkward, and so we just decided we might as well come home. I've been very pleased with the hospital. We've got some really experienced nursing staff. I can't say enough good things about your hospital medicine team that was already here. And so it's coming from a hospital medicine environment and kind of seeing how things are normally done and the workflow, and coming here, just meeting the hospitalists that you already had on staff. I was very impressed, and without going into all their names, with every one of them, they're just wonderful. And so very capable and caring, thorough, and even procedurally skilled hospitalists. So I was very impressed with that team, and that's probably most important, because that is where I'm working. Outside of that, we have really good relationships with all the surgeons, and specifically urology, vascular, ortho, general surgery, all wonderful, and really good working relationships, great consultants, good communication, and they take good care of patients.